Over 60 million Americans share a common eye disorder called myopia, more often referred to as nearsightedness. But now, after years of clinical trials, there is an alternative to glasses and contact lenses that is safe and effective. It's called laser correction of nearsightedness. Thousands of people have already made the choice. In fact, more than 500,000 eyes have been treated over the past 7 years in 45 countries around the world. And now it may work for you. Because laser correction of nearsightedness offers the potential to reduce your dependence on glasses or contact lenses, or in many cases, eliminate them altogether. And for those people who, for whatever reason, have never liked to wear corrective lenses of any kind, it's an exciting alternative. Our eyes work by bending or refracting light rays to meet and focus at a single point. In a normal sighted eye, light enters the cornea and focuses on the retina, located at the back of the eye. The result is a sharp, well-focused image. When you're nearsighted, the cornea is too steep. The steeper the cornea, the more light rays are bent. So when light enters the eye, it focuses short of the retina. The result is a blurred image, and you are said to have myopia or to be nearsighted. Some people may also have astigmatism in addition to their nearsightedness. Your doctor can tell you if this is true in your case. With astigmatism, the eye has an asymmetrical shape, often oblong, like a football. Light rays converge at several points on the retina, without a clear point of focus. The result is another type of blurred image. When you're farsighted, the cornea is too flat, so light beams aren't bent enough. Now, when light enters the cornea, they focus beyond the retina. There are several ways that people with nearsightedness, astigmatism, and farsightedness are helped to see better. To date, the most common are glasses and contact lenses. For those people who would like to minimize dependence on glasses or contact lenses, there are two alternatives: RK and laser correction of nearsightedness. The goal of both these treatments is to flatten the front surface of the cornea to restore your vision to its natural state without the aid of glasses or contact lenses. Radial keratotomy is a surgical procedure where incisions are made into the cornea. The length, depth, and number of incisions will depend on the steepness of the cornea and on the desired correction. These incisions are intended to flatten the cornea. Laser correction of nearsightedness typically involves only about 10% of the thickness of the cornea. And the laser is so precise, it can remove a single layer of cells without affecting the next layer. In laser correction of nearsightedness, an excimer laser emits a rapid succession of laser pulses. With each pulse, the beam spot widens, removing microscopic layers from the surface of the cornea. The total amount of tissue removed is less than the thickness of a human hair. The result is a flattening of the cornea that has proven to be effective in reducing mild to moderate myopia from 1.5 to 7 diopters, and in reducing dependence on glasses and/or contact lenses. In fact, in the U.S. clinical trial studies that were reviewed during the approval process for laser correction of nearsightedness, everyone studied experienced improved natural or uncorrected vision. And in evaluations of patients 6 months after their treatment, 95% saw 20/40 or better, which in most states is acceptable for driving without glasses and contact lenses. And 2/3 of the patients saw 20/20 or better. As with most treatments, there are certain potential risks that you need to be aware of. Carefully review the patient information booklet that will be provided by your eye doctor to learn more about potential risks and complications. We encourage you to consult your eye doctor if you have additional questions or concerns. On the day of treatment, the patient should be accompanied by a friend or relative. or should make arrangements to be driven home. Prior to treatment, you can talk with the doctor to review any questions you may have. Once you're ready, eye drops are administered to numb the eye. After the drops have had a chance to take effect, the patient is led to a treatment room and positioned in a comfortable chair underneath the laser. The results of your eye exam will determine the treatment parameters that are entered into the laser. A small device called an eye speculum is placed in the patient's eye to prevent the eye from blinking. The patient is centered beneath the laser and is asked to focus on a small bright light inside the bottom of the microscope. Once the patient is properly aligned and feels comfortable focusing, the actual treatment may begin. The actual laser delivery time is generally between 15 and 45 seconds, and the number of pulses that are delivered is dependent on how much correction is required. After the treatment, ointment and/or drops are placed in the eye to facilitate the healing process. Treatment follow-up generally involves several visits to the doctor. The exact after-treatment schedule will be determined on a patient-by-patient basis at the discretion of the doctor. The patient will generally notice improvement in their vision within 3 to 5 days after the treatment. And although their vision may experience minor fluctuations over the next few weeks, vision usually stabilizes within 3 months.
I had always, when I wake up in the middle of the night and want to see what time it is, have to pick my clock up and put it next to my face. This particular night, it was the second night after the treatment, I happened to just open my eyes a little bit as I rolled over in bed, and I saw what time it was, and I thought, oh man, I forgot to take my contact lenses out. And then I realized it was my own eyes, and I just about started crying. I got goosebumps, and it woke me up completely, and I just sat there. It was like looking at things in my room, because that was my first real glimpse out of my own eyes.
As with any treatment, you probably have a number of questions. We've included answers to some of those questions most frequently asked.
The actual treatment itself was effortless. It was maybe 30 seconds. I went in and sat in this lounge-like chair and stared up at the little green light, and it was done 30 seconds later. I was shocked and amazed. Is this done? I went out into the lobby, and my mother, who was waiting to take me home, said, when are they going to start? I said, they're done.
Is laser correction of nearsightedness painful? Although the treatment itself does not hurt, patients generally experience some level of discomfort during the first 24 to 48 hours following treatment.
It's really nice. You're piled up in the car and you're sent home, and within a day, you have about a day of, where it hurts a little bit, and pretty soon it just gets clearer and clearer. Every day it improves, and within like a month to 3 months, you're seeing clear incredibly. It's amazing.
Will the treatment be permanent? Given the results of the U.S. clinical trials submitted to the FDA for U.S. approval and the data that exists internationally, there is every reason to expect that the treatment is permanent.
It's been years now since I had, a couple of years since I had the procedure done, and to this day, still a clear day like this morning, to be able to see the delineation of the mountains, or to see the knife's edge of the horizon at the ocean. Every little thing like that, I just get goosebumps. I just get goosebumps.
It's a wonderful procedure, and it's based on, it's good technology. It's not anything that's particularly dangerous or scary. It's safe, and it's well researched, and they do a lot of testing before, and it's just, it's incredible.
What if I blink or move my eye during the treatment? First of all, a small device holds the eye open throughout the treatment, so blinking is not possible. During the treatment, the eye doctor is in complete control at all times. The entire process is monitored through the microscope, and the doctor can interrupt the process at any time should the patient have difficulty holding the eye still. Minor movements of the eye do not affect the treatment. Your eye care professional will be with you shortly to determine if you're a potential candidate for laser correction of nearsightedness. and to answer any additional questions you may have.
Since I've had the treatment done, my vision now is clear and sharp. No more contacts, no more glasses.
Well, before the treatment, neither one of us could see. We were very, very nearsighted.
Well, the difference for me before and after the treatment has been like night and day. It's affected every aspect of my life.